Hi, this is Howard Tiano. I'm here today with Dr. John Berman, and we are going to be discussing selecting your plastic surgeon. He's located in the Boca Raton area, and we'd like to thank Dr. Berman for taking a few minutes out of his day to help us out with some of these questions. Thanks for coming, Dr. Berman.
My pleasure.
All righty. So we're going to be talking here. We have a few questions that people have sent in. And first, we'd like to ask, what things should people look for when they're choosing a plastic surgeon?
Well, I guess one of the things is the reputation. How do you get your reputation? What people think about you. So basically, in terms of reputation, the reputation usually comes from word of mouth. Happy patients usually come from people who have excellent results. So the more you operate, the more happy patients you have, the better results. That's one wonderful and probably the best way to find out about a doctor. Medical referrals, basically the three cardinal things are try to be affable, available, and affordable. The medical charity work, does he, if the man works in the emergency room or takes care of indigent patients, does other functions to help people that are not as well off. So there's a charitable side of the practice, as well as the direct interaction the doctor may have with the nursing staff and the hospital staff, because those would be more of the direct things what they do in a hospital. The social activities the doctor's involved in, charity involvements, non-medical social activities, civic activities. Maybe he's a runner, so maybe in a runner's club. You meet people, they talk about the doctor or they ask questions, and that will make your presence known amongst the community. You also have your own personal networking with your friends and family and who they know, and that's very, very helpful. And in modern day, certainly there's now an ever-growing presence of the internet. That's why we're doing this video for questions people may ask. So searching the internet, searching things like vitals.com or even Google or Yelp for different things about the doctor, which will, you'll have patients or people will post things good or bad about you. So you just need to use some filtering, but those would be reasonable ways to find out about the physician in hand, as well as does they have a website, and looking, because the website now is the nowadays or the modern Yellow Pages, which is usually much more interactive,
right,
much more robust, and you can read about the doctor's credentials. You will then certainly be able to see his take or his philosophy about how he practices and what he likes to do. You'll probably glean what his areas of expertise are. And then, of course, there's always that area where there'll be people that will put things up, or the doctor will post things about testimonials, where people will tell how good or how they feel about the procedures they had done. And nowadays, oftentimes, like we're doing a little video, some of the savvy, sophisticated practices will have patients that will give video testimonials about their experience with that particular practice and the doctor. There's also handwritten ones that some people who are older, they're not as internet savvy, that write nice letters, and now you can post them to the internet through your website. And of course, the last thing, which is always helpful, is what your before and afters look like. Certainly you want to go to somebody I would think that if you want somebody that's going to do some body work on you or facial work, you want to see somebody that is one of the similar things that you've wanted. Look at some pictures so you can see what kind of work the guy does. And you'll probably find out the more skilled the physician is, the better the results they're going to get. That's kind of goes par with the, hand in hand. So that's a lot of information in a very, very short period of time, so I hope I didn't confuse anybody.
I don't think so, but in terms of expertise and experience, you started touching on that. I think people get a little confused sometimes about the difference between cosmetic surgeons and plastic surgeons. Maybe you can help clear that up.
Well, that's a long answer. So basically what it comes down to, maybe very briefly and succinctly, plastic surgeons are, for the most part, if they're doing cosmetic surgery, will probably label themselves as a cosmetic surgeon, but not all cosmetic surgeons are plastic surgeons. There are certain people that certainly it's very lucrative to do cosmetic surgery because people are paying you cash for the work, and therefore You got to be very careful as to who. I tell people all the time is to check their credentials, learn about the person that they want to have their work done, and make sure they have the credentials that you're looking for. And credentials mean a lot. I mean, let's face it, everybody wants to go to the best colleges, Stanford, Harvard. Some people meet that criteria and then get into these places. Mark Zuckerberg and Bill Gates, for example, those are superstars. So quality education is really important. I think thinking about when you learn about the doctor or the person you want to do something, you'd probably think a little bit differently about somebody who went to an Ivy League school than East Podunk. Same thing for the medical training that they get. So quality education, exemplary training. You want to go to somebody that's had a quality hands-on medical training as well as excellent teaching. A lot of programs, there's a lot of things that are being taught, and therefore there's not a lot of practice for the young physician learning how to do certain things. So it's always important, I think, when you talk about a surgeon, that you want to make sure that surgeon went to a place in his training where he had a lot of hands-on experience to learn the skill set that he needs when he gets out in the real world. Board certification, a lot of boards, but there are certain real boards, I would say, and certain boards that are not real. The most important boarding areas, there's a company called the American Board of Medical Specialties, and they are the granddaddy. They are the ones that basically say the plastic surgery, the American Board of Plastic Surgery, that's a real board. The American Board of Otolaryngology, that's a real board. I'm double boarded by both of those boards, but the American Board of Cosmetic Surgeons, I don't see them as being sanctioned by the American Board of Medical Specialties, for example. The American Board of Liposuction, I don't see that being sanctioned by the American Board of Medical Specialties. So, it's easy today to do the homework to check on credentials because the internet is really fabulous for anybody to do any kind of homework for looking for this information. And I think that would behoove you very strongly that when you go look up a doctor, learn about the credentials a little bit, because you kind of want, if you have a certain idea in your mind and what you're looking for, you can be certain to find out for sure what these people are. And certainly if you want to compare apples to apples, it's relatively reasonable to compare plastic surgeon A against plastic surgeon B when you look and say, yes, they're both certified by the American Board of Plastic Surgery. Yes, they're both members of the American Society of Plastic Surgeons. But I think you may feel a little bit differently when you're looking to have something done. It says certified by the American Board of Liposculpture, American Association of Cosmetic whatever. So there's certain, real boards that I would say, and not so real boards. So
I see.
Those I think are very important. And the next part of the conversation is, for in terms of being a business and the practice, when you go to any of these places, what kind of staff do they have? I mean, a phenomenal staff is going to make or break you. And I've been very blessed that I have a very, very excellent staff. They're conscientious, they're happy, they're concerned, and I realize that nobody can do it all by themselves. Everybody in the staff's important, so it's really important to build a team, and there are different players on the team, and every player has a certain function, the same way as why on a baseball team your third baseman has a certain set of responsibilities, your catcher has certain responsibilities, your center fielder is important, and together those 9 people on a baseball team function to make a winning team. And it's a similar thing in my practice. Everybody has their little skill set, and there's a lot of overlap. I mean, it's really important to have a good shortstop in a baseball team so they can cover second base and turn a double play. So it's really important that one hand washes the other in your staff so everybody functions well together as a team. The last thing I think is just super important is experience. You want an experienced staff, but it's also helpful. It's good to have an experienced plastic surgeon or physician. Look, I've been in practice for 22 years. I had 7 years of training before that. I've got the gray hair. I've been doing this for quite some time. I think I've got a pretty good idea what's important and what's important and what's not important. So I think practice it keeps a very dear school because it's important because things change. You can look at the new techniques and compare them to the older techniques and adopt which technique you feel is going to be the best for the patient you're taking care of. So you need the experience to have the old knowledge base so you can use that old knowledge base with new techniques to deliver the best quality care you can for the patient taking care of. And there's certain things, look, nobody, as I said before, nobody can do it all, and nobody can do it by themselves. And certain physicians, certain plastic surgeons have certain expertise. You know, I did an ear, nose, and throat training before I did my full plastics training, so for sure, up in the head and neck area, I feel I'm very well, I've been very lucky with that extra experience. So dealing with the head and neck, I think I do a bang-up facelift, I do a beautiful rhinoplasty, or nose surgery, I do a lot of eyelid surgery, I do neck liposuction, and, you know, more of the head and neck facial plastics. Perhaps maybe I'm more skilled in that, but I'll tell you what, I have patients I do breast augmentation on, and I do tummy tucks on that are thrilled. So that and liposuction. So you can't do it all, but I do know to, you know, to be able to be very good in what I do, it's really important to be able to have your skill set honed to maybe choose a number, maybe to do 6 to 7 operations superbly, and then be realistic. You can't do everything well. So you get known for those 5 or 6, 7 different procedures that you do. And maybe that's too much for some people, but, you know, that's been my experience.
Wow, that's a lot of great information. Well, you know, another question I had was somebody who is coming to your office for the first time, they may be a little apprehensive. What kind of experience could they expect coming into your office?
Wow, a great one. We take really good care of people. I try to create an inviting, friendly, and comfortable environment. I've set up my office like a beautiful old world library, which is warm and inviting. There's soft lighting. We have current magazines, fresh flowers, so it doesn't look like this sterile doctor's office. And after all, one's perception is one's reality. It's crucial to build a trusting relationship, so we begin by making sure the environment we think is friendly. I have friendly and knowledgeable staff. And I think I'm pretty friendly and I'm pretty knowledgeable. So those 3 things have been kind of the winning formula that we've been using for over 20 years. You know, these create the signs and the feel of specialness of the practice. And I think people are very able to determine and feel what's special about the practice. And the first most important thing is the people. Sure, the environment is very, very important, but it's the people. The people create the warmness. They create the comfort. And trust me, when you're talking about cosmetic improvement, it's a very individualistic type of experience for somebody, so you have to build, you want the patient to feel that they can trust you. So we listen carefully to our patients and spend a lot of time with them listening to find out what they really want. So in doing so, we develop an individualized plan, whether it be surgical or non-surgical. We can show lots of before and after pictures for people that are asking for a similar thing to do. So the whole idea is when they leave the office, we feel comfortable that they leave knowledgeable of what they came in to ask for, or maybe learn something new. They feel they had a comfortable experience, and they're excited to go forward, meaning that they're interested in wanting to do surgery. And we have a really good closure rate, so we obviously are trying to do things to make people feel comfortable what they want, and I guess we're fairly successful at it.
Well, that sounds great. I would say at this point they got a lot of information to go on, so they got a lot of homework to do before really selecting their plastic surgeon. So if someone wanted to go to your website, why don't you give out your web address so they know where to go to find you
Sure.
and take a look at your work?
Well, my web address is www.drberman.com. And we think it's a pretty robust website, and it's a pretty good educational place. You'll learn about me. You'll learn about the different procedures. I've already mentioned that we have some testimonial videos, which are real helpful, and I think we've got over 20 of them, so if you don't like what one person says about one breast augmentation, you'll hear from somebody else about another breast augmentation. So we try to make it a very, very nice experience for the viewer. It's a friendly place. It's easy to navigate. And, of course, we have our before and after pictures. But, you know, I didn't do this all by myself. I've got great staff, and that's the key. Having phenomenal staff. Having smiling, knowledgeable, happy, cheerful staff is what it's all about. And that's evident because they like what they do. They're committed to the practice which we set up. And one thing which I tell my staff all the time, and people say, is I said, can you tell when my staff answers the phone, can you tell that they're smiling when they're talking to you? Well, I've watched around, you know, as the boss. They're smiling when they're talking to the people on the other end. So I know that the person who's on the other end of the line is feeling that they're happy and there's a smile and there's a happiness to their conversation. And again, it's a team effort. We always try to improve, but I can't do it by myself.
Well, thanks so much for your time today. I'm sure a lot of this information is going to be really helpful to the people viewing the video. So once again, thanks for your time. We've been with Dr. Berman, based in Boca Raton, so you can contact him at his website, drberman.com, or the phone number on the lower third on Dr. Berman's screen. So thanks again, thanks for your time, Dr. Berman, and we'll see you again around town in Boca.
Thank you very much for this opportunity. Have a great afternoon.